You are watching Channel 20 TV. Be with Channel 20 and let us make things better together.
Dear viewers, we'd like to welcome you for our show, and today we have got with us Dr. Amesh. He's a senior scholar from Johns Hopkins University, and we'd like to discuss some of the current issues relating to pandemic. And let us welcome Dr. Amesh and then hear it from him. Hi, Dr. Amesh, how are you today?
I'm good, thank you for having me.
Thank you, dear. So what you are currently busy with, what's your current focus at your workplace?
So I work at the Center for Health Security, which is a think tank that works on infectious disease emergencies. So right now I'm trying to understand how do we take the lessons from the COVID-19 pandemic and make the United States more resilient to the next infectious disease emergency? How do we develop a program where we can get vaccines faster, diagnostics faster, antivirals faster, so that this never happens again? So I'm really trying to focus on thinking about the next threat that we face. I'm also a practicing clinician, and I take care of patients as well, so I'm still doing that as well. And then I'm also talking a lot to the general public about the importance of COVID-19 vaccinations, because in the United States, we have a very uneven uptake of the vaccines, and there are some states that we're worried about because they don't have enough people vaccinated.
Right. And, being a general public or for normal people, regardless Americans or non-Americans, we get often confused about the wave numbers. Second wave is coming, third wave is upcoming. So we get confused. And also there are a lot of different terms we get being non-medical, people, like, oh, this is the new variant, this is South African variant, this is Delta variant. So what's going on? If you can just simplify these terms and what's ongoing for the general people so that we can feel a little bit comfortable.
So you have to know that since this virus made its way into humans, it's been mutating. It's been creating new variants, and most of those variants are really of no concern. But there are several variants of what we call variants of interest or variants of concern that have changed the characteristics of the virus, making it more transmissible, for example, or making it able to cause problems for vaccines or treatments. And that's what the Delta variant represents. The Delta variant was initially described as the Indian variant, and this is a variant that appears to be one of the most evolutionary fit versions of the virus, one that transmits efficiently from person to person, and that's become a major issue. But this issue is not uniform. This issue is really only for those individuals who are not fully vaccinated. So the Delta variant's trajectory is that it's going to become the dominant version of this virus. Whether or not it causes problems is going to be what level of vaccination you have in your community. So in places where you have high-risk individuals who are not vaccinated, you're going to see hospitalizations rise. And that's what's happening in parts of the United States, like Springfield, Missouri, for example. But in other parts of the country, you're going to see cases go up, but it's not going to translate into hospitalizations or hospitals in crisis because the vaccine has been given to so many high-risk individuals that you've decoupled or separated cases from hospitalization, severe disease, and death. And that's been the whole goal of how we're trying to move forward in the United States with this pandemic. It's to try and make COVID-19 like a more manageable respiratory virus that we deal with year in and year out. And in many parts of the country, that has been the case because so many high-risk people have been vaccinated. But there are some pockets where it's not quite there yet. And I think that's the trajectory we face in the United States, is trying to stamp out these areas where the virus can get a stronghold because there's not enough vaccinated individuals.
Well, what I've understood from you, that means it's not so easy to manage the public healthcare, and especially during this pandemic. So third world countries, suddenly they're facing a lot of challenges with this pandemic crisis and managing this public healthcare system, especially to fight against pandemic and COVID-19. So you know very well there are some countries where there's some openings that are going on. They're opening it down for, building back better situation. And some countries are again going for lockdown or emergency situations. Being a global citizen and being a global, icon for the medical sector, as one of the icons, if I say, how do you feel? I mean, do you feel sometimes it makes you insecure as a citizen because some of the external threats may come again inside to your country, to your community, or you think it's fair enough for them to judge individually and go for their own decision?
Well, we know that until COVID-19 is controlled in all corners of the globe, that the world is still going to remain at risk, that we are still going to have disruptions to our lives, travel and trade will still be restricted. So it is really important that all countries get control of this virus. That doesn't mean eradicating it or eliminating it. That's not possible. But what it does mean is making sure that your high-risk population is vaccinated so you don't have an uncontrolled situation where hospitals are running out of equipment or staff or personal protective equipment. So I do think that we are on very different paces in this world, and it's going to probably be well into 2022, maybe even 2023, before the pandemic is over for the globe. And I think that has to be one of the pressing challenges, is reducing the harm that this virus is causing all over the planet. Because it is true that infectious diseases know no border. And we do have unvaccinated in the United States, even though we're a highly vaccinated country, only 48% of our population has been fully vaccinated. So there is an opportunity for more contagious variants or worrisome variants to take hold, and that's going to be disruptive. It may not put us into crisis, but it's something we want to avoid. And the more opportunity this virus has to infect people, the more variants that are going to occur. That's why we're dealing with the Delta variant. The reason that the United States has a Delta variant issue right now is solely because we don't have enough people vaccinated. So this is going to be really important, is to take away that opportunity for COVID-19 to continue to menace the world. And the only way we're going to do that is by vaccinating more people wherever they may live in whatever country or corner of this planet.
Mm-hmm. Now, let me go back to the situation of vaccine, as we were talking about many times about vaccine. What do you reckon about vaccine management system, particularly in the United States and also other parts of the world? If I say United Kingdom and other European countries, what do you reckon? I mean, being the parental body in healthcare, WHO is playing. I don't know, is it very sensitive for you to answer or not? But are they playing the true parental role in vaccine management, or you think we are having a vaccine politics nowadays? If you have money, you get vaccine being a country. If you don't have money, being a nation, maybe your turn will come later on. I mean, what's going on in your opinion regarding vaccine?
Well, I definitely think that countries that invested in vaccines ahead of time, had pre-purchase agreements, including the United States specifically, have been able to do very well with vaccines. There are countries, even high-resource countries like the EU, like countries of the EU, like Australia, where they did not secure doses. They were not proactive about it. There are countries also like India who thought they could fare okay without a vaccine. That's come back to haunt them. So I do think that there is a role for all countries to have tried to secure vaccine ahead of time. And obviously the United States and other countries were going to be aggressive because that was the only way they had out of the pandemic. The WHO, even it is a coordinating body, it doesn't have power. So it's not, what it can do is it can move the discussion, it can facilitate, it can coordinate. And I do think that there are good programs in place to get vaccine to everyone in the world, things like COVAX and CEPI and the Bill and Melinda Gates Foundation. But it is going to take some time for the world to get vaccinated. And I think this was predicted, and we knew that there was going to be vaccine nationalism. And one of the dark stories of this is that we had export restrictions in many countries where companies couldn't sell outside their country. And those export restrictions had no place. They shouldn't have been initiated in the first place. And it would be good if they were actually lifted. Some other countries actually had import restrictions where you couldn't import scientific materials into that country. For example, India had something like that, which made it harder for to secure supply. So there has been a lot of what I would call mercantilism and vaccine nationalism, that some of it is going to happen no matter what. However, the export restrictions and the import restrictions, the restraint of trade, I think really made this much worse than it needed to be.
All right. So often you're, precisely, highlighting the issue that we need to get vaccinated. True that we do understand and we do admire that. Now, how confident you are? Do you reckon that if we are vaccinated, we really can restart our previous life, or we can get really new normal? What do you reckon? Do you really believe it?
I do believe it. If you've been vaccinated, especially with highly effective vaccines like Pfizer, Moderna, Johnson & Johnson, AstraZeneca, that you can reclaim your pre-pandemic life once you're fully vaccinated. And I did myself. I was vaccinated with the Pfizer vaccine, and I don't have any worry, because once you're fully vaccinated, you are no longer a threat to others, and others are no longer a threat to you.
Good. Fantastic. Even I got vaccinated by Pfizer and I've completed my 2 doses. Though Pfizer is talking about their 3rd dose that it can, perform 5 or 10 times more better, but we don't know about their decision yet, and also the endorsement by WHO. Anyway, in terms of inequalities in the healthcare system, what's the situation in America? Because recently I had a discussion with Dr. Farzana Hussain, the GP of the year 2019 from NHS UK, and she was precisely mentioning about this issue even in the United Kingdom. What about in US? What would you think about inequality in healthcare system and benefits? Is it pretty significant in number, or you think a country like America is getting better over there?
Well, when it comes to COVID-19 outcomes, we've seen that, for example, the risk of infection was higher in Black and brown populations. The risk of death was higher in Black and brown populations. And it had less to do with access to healthcare, but more about the way policies were put into place, that many of those individuals had jobs for which they couldn't telecommute, they couldn't work at home, that they had to go out and be in the public. We also know that there are other issues like diabetes and obesity, which are more common in some of those populations, that synergized with the pandemic and made it hit them much harder. However, when it comes to the vaccine, there have been specific programs put in place to actually get them to have a high uptake of vaccine. It's still lagging in those populations, and I think that we need to do better at reaching those populations, but I think it is something that we've recognized and tried to overcome.
All right, so what's your forecast about this COVID-19? When we are going to say really goodbye to this COVID-19, do you see any hope nearby?
You have to remember that this is a virus that's going to establish itself in the human population. It's an efficiently spreading respiratory virus that has an animal host. So it is not going to be eliminated. It is not going to be eradicated. It is not going to magically go back into bats. So we will have COVID cases 5 years from now. But what the difference will be is that COVID will be more like another respiratory virus, like the flu, because we'll have vaccinated so many of our high-risk individuals. So it doesn't have the ability to threaten hospital capacity the way it could in the past. So that's where I think the trajectory will go, that this will establish itself. It's going to eventually become a seasonal respiratory virus, but we need to get more people vaccinated to get it to that status in the world.
All right, so suppose if you would like to give you the role of pandemic firefighting team, and then if you'd like to ask you that what will be your magic decision that you'd like to take it now, what would you like to take?
What I would like to do is tell the governments of the world that it's very important to invest in public health infrastructure, because we will face new infectious disease emergencies in the future. We will have new pandemics, and you have to have a proactive approach. You cannot be reactive. You have to put in place programs that will rapidly detect and deal with these types of issues when they arise. And this has to be a priority, because if you look at the pandemic's trajectory, especially in the United States, it was a failure of government, failure of federal governments, failure of state governments, failures of local governments. We cannot allow this to happen. This needs to be prioritized, and we have to get out of these cycles of panic and neglect, where when something is in the headlines, you fund public health, but when it recedes from the headlines, nobody cares about it. We have to have a sustainable approach and think about how certain infectious disease threats are national security threats.
Sure. We're almost in the end of our show, and we'd like to ask you, what's the specific social message you'd like to give to the general public right now?
The message I would like to give to the public is get vaccinated. Tell your friends, tell your family members, tell your coworkers to get vaccinated. That's how we get out of this pandemic. And just be much more attuned to the risk of infectious diseases and demand solutions from your local elected officials that they take infectious disease threats seriously so this never happens again.
Good. Dr. Amesh, my final question to you. How did you feel, being with us with Channel 20 for the last couple of minutes? How's your experience with Channel 20?
I'm glad for the opportunity to speak to your viewers, and I hope that was useful to them.
Thank you very much, and we're going to connect with you again and again, and I'm sure let us be all united for the sake of humanity and fight against COVID-19. Thanks once again for your time.
Thank you.